you for subscribing to the Frequency Specific Microcurrent podcast. FSM is a breakthrough tool for medical practitioners who feel stuck with limited treatment options, especially for complex issues unresponsive to conventional care. FSM training is the best continuing education course for medical practitioners. Get our free introductory webinar at frequencyspecific.com/about or find FSM trained practitioners at frequencyspecific.com/find. Here's Dr. Carol and Kim Pittis.
Once again, but welcome everybody. Dr. Jennifer Sosnowski is back to be my amazing co-host today because I have to fill the hour somehow, some way when Carol's not here. And when I think about all the questions and not only that I have, but all the emails that come in, I figured that there'd be no better person to join us today than you. So thank you so much for making it happen.
Absolutely.
Such short notice, but you did it. Thank you.
You're welcome.
And you got here before me. Hopefully everybody can hear me okay, can hear Jen okay. Throw it in the Q&A or in the chat. Same rules apply. If you have questions, we'll get to them. But when Jen and I were talking a couple days ago about what we wanted to talk about, I feel like we never have a shortage of things to talk about. If anything, I wish there was another hour with you when I get you. But we came up with a bit of a plan today. And I think the theme of today, I was writing it down the other day, the theme of today's podcast needs to be, I need to get out of my own way. So what I wanted to really talk about a lot is, as practitioners, I think no matter what field we're in, we have this desire to help people. And most of us throw everything that we can at our patients, and we think about the treatment plan. And at night, we stay up at night thinking, geez, I hope they feel better. I hope they're going to do better. But there are times when no matter what we do as practitioners, just isn't enough. And so I really wanted to talk about some things that our patients and clients can do that maybe we don't think about, and just some of the things that we can do to support their healing, maybe at home, because we talk a lot about what we do in the clinic. And I do want to talk about some in-clinic treatment. But when we think about the hours in the day, maybe we get them for 1 or 2 hours. That leaves a whole other 22 hours in the day that they could be potentially undoing, and not intentionally, but undoing what we're trying to help. So does that sound like what we talked about?
Yeah, for sure.
Okay.
For sure.
Okay. So what, in your opinion, do you think is some of the top hindrances for healing? And I know that's really, really broad, and we can go broad and go spin it to be a little bit more specific. But if you think of some of your toughest clients and patients, what are some of the things that they could be potentially undoing at home to combat like the treatment plan that you've given them?
When I think of my chronic functional medicine clients that I'm using microcurrent on and every avenue I have, I think one of the first things I discuss with everybody when they come in the door is that this is not just a physical problem. It's a spiritual problem. It's a mental problem, mental being stuck emotions from past traumas, and it's a physical. And you have to get the other two in order to be able to get the physical to do what we want it to do.
I want to even just stop before we go further, because I think that's so rare. Like, how many times do you see a physician that even talks about those other two things, and everything has to be physical? So right away, hats off to you that you bring that up on the first visit, because that just shows us how important it is.
Yeah, and really it's critical. It's one of the basic tenets that we learn in functional medicine, is that emotional hurdles are a huge impedance to getting better. But because I ask all those questions in my questionnaires, have you had past trauma? Have you had major losses? Have you had somebody die on you? That's important. It's in the middle of another questionnaire, in the middle of the 200 questions that they're answering. And by the time they get there, they answer it honestly, because they're not even thinking anymore.
Right.
So I already know the answer before I ask the question most of the time. But
Yeah.
I don't really know what it is, but that's given me the avenue to jump in and start picking it apart. And what I find is that every single chronically ill person has past emotional trauma. I think most of us do, but the people that are chronically ill, every single one of them have past big emotional trauma that's still stuck with them.
Yeah, that That's amazing. So again, I always say there's a lot to unpack in that little sentence, but there is a lot to unpack. So when I'm meeting somebody for the first time, there's probably a lot that I'm not disclosing right away, right? There takes some time to feel comfortable and you have a relationship with people, but now knowing what I know, when I see somebody for the first time, I'm brutally honest with, almost to a fault, where they're just like, okay, that was a lot. I'm like, if we're going to work together as a team, you need to know all the information, not just about a segment of me that I'm willing to share with you. So, how much of that information do you think you get right away versus how much you get later on? And do you think you can even help with, and I'm sure you get a idea, like you were saying, like you have an idea already of some of the trauma that somebody might have.
So I probably spend 10 or 15 minutes doing some basic discussion about what functional medicine is and where we're expecting to go in this hour consultation. But then I dive right in, because the next thing I do before I discuss how this is all affecting their life and where they'd really like to be rather than sick like they are right now, I was like, hey, there's 3 parts of getting better. And one of these is the spiritual part. And I have a hard time believing that you can tolerate the stress in the world without believing there's a God that can take part of it on. What's your feelings on that? Do you believe in spirituality? And so that kind of breaks the ice a little bit, something you don't have to believe, but I'm saying where I believe in that, and I'm happy sharing. But then I go straight into emotional hurdles. As we know from functional medicine that these emotional hurdles from past events prevent our chi, if you want to use the Asian way of thinking about it, prevent our chi from running everywhere it's supposed to if we've got an emotional block that's sitting somewhere in us. And so we've got to address that to get better. And then I can go straight into, you said you had some trauma in the past. Can you tell me about it? And it's interesting because I just had one of my most interesting guys that I've had a long time come through, and he's this multimillionaire businessman, has started multiple businesses in his life, highly successful, and he's a big athlete, so that fits your world as well. God forbid you take him away from his running. But yeah, exactly. We know how bad that is for both of us.
Yeah.
But you take him, he injured his leg on a treadmill. He turned it on too fast and fell off. He's in his 70s, fell off, injured his leg. And all of a sudden he went into this thing where he's got a drop foot. So he's been suffering with drop foot, and he can't exercise. He can't walk. He's got a bad shoulder on the left side, a bad foot on the left side, bad hand on the left side. Left side is maternal, right side is paternal, left side is maternal. Actually, I think it's the other way around. I think it was his mother issues. Okay. I got them backwards. Anyway, I believe it's the left side that's paternal and the right side is maternal. His was all right side. But he literally came in telling me, oh, it's really funny, this walking thing. I'm using a walker here, and he literally is barely moving. He looks like he's got Parkinson. He's barely walking down the hall. And he's definitely having a problem keeping that toe up. And yet I was at my house earlier today, and I can walk up and down the hall fine with no problems. And he's barely moving on his walker. And he's like, why would that be? I'm like, what you're telling me is there's a huge mental component here. And so I get in the room and I'm like, so what happened in life? What happened in childhood? I literally just went straight to it. I'm like, wow, this is 100% psychosomatic. If there's ever been psychosomatic in my entire life, this is it. And he immediately started crying and talking to me about how bad his childhood was.
Wow.
And his wife came back when he finished his paragraph and got himself a little bit more together. She's, oh my God, I have never heard that story. We've been married 45 years. I have never heard that story. And when the kids have asked him about his childhood, he never shares. He always just passes it off. Oh, I don't really remember. I don't really remember. Wow. Never, ever share. How did I get that in 5 minutes of working with him? Maybe he was desperate enough just to share. But that's everything.
Wow. And I think when some people are ready to heal and share, and when they're at that point, sometimes it's almost like they need that permission, like, tell me about this. And then they're like, oh, it's like finally somebody's asked me. And like to your, or to their point, the kids have asked, but maybe the platform wasn't right, or I'm not sure. Who knows?
I think to some extent for him, and then this is not necessarily everybody, he was in so much agony already, having his exercise taken away, thinking he was developing ALS. One doctor told him he was developing ALS. So he's, oh my God, I'm in a wheelchair, I'm dying in 2 years.
Yeah.
He was so in a state of anxiety that being able to talk about something that was really anxiety provoking didn't make a difference anymore. Versus my life is calm, cool, collected. I've got it all under control. I'm just controlling it with exercise. And now all of us, and I don't want you to ruin that by talking about things that are stressful.
Isn't that is fascinating when you put that together? And I know a lot of patients won't be so forthcoming, but I think, and you were talking, and we talk a lot about taking really thorough patient histories, and the more, I'm sure, quote unquote, regular doctors move into the functional medicine world, and even us practitioners moving into the FSM world, and we see the connections and we see the branches and talking about the emotions and stress and day to day, giving people the platform to pull those connections together and say, yes, this absolutely does affect your recovery. This affects your healing. This affects your symptoms. And giving them a reason and that validation, I think, is huge, because so many medical practitioners won't put that together.
Correct.
We're even just seeing now in dentistry that the mouth and the body are connected, something that everybody has known for a while, but for so long, they've been completely separate entities. Dentist deals with mouth and doctor deals with everything else, but our mouth is in our body the last time I checked, and everything is connected. So the same thing with the emotions. And I also want to just say it's great that you're even bringing up spirituality, because I feel like that's another taboo topic that we've been told at a very young age. Don't ask about religion, don't ask about politics. And yes, they can be very polarizing topics, but like you're saying, you're not judging, you're not saying this is what you have to believe, but let's talk about if there's a component there.
And yeah, I've had people come in and say they're Buddhist, and people come in and say they believe in spiritual something, but not God per se. And I'm like, that's awesome that you believe in something. I'd love to say, hey, you need to believe in the guy that I believe in because I think he's the best, but that's not my place as a physician. It's my place to say, hey, you got something that's bigger than you that you can let part of the stresses of the world off on.
What advice could you give practitioners? Not everybody is a physician, not everybody is a counselor or a psychologist.
We're all counselors. Are you kidding me?
The stuff I've told even my hairstylist over the years.
Exactly. They're your best counselors.
Absolutely. And cheaper in some ways.
Yeah, yes.
So I know we can't give advice, but there's a lot of, we talk about this phrase like holding space for somebody. And as a mother of teenagers, I understand this. It's like when somebody is exploding to me, I've learned to say, would you like advice or do you need me to listen? And I think for the most part, people just need somebody to hold space and have that safe environment to let it out. It's not about guiding them through it, and there's a space for therapy, but what do you typically do, or what would you advise people to do? Is it to just keep quiet? Is it to just give them a platform? What is it?
I think keeping quiet is probably not the best thing to do, because then the client never knows whether it's okay to share or not okay to share. Because being quiet can be taken as a negative or judging versus being open and familiar and comfortable. So I typically like to normalize for people. Yep. Hey, everybody that's in here, like you, with some chronic issues, has underlying issues, has suffered big traumas that are still affecting them. Please feel free to share. It's going to help me get you better. But I also tell them, you're not alone. Everybody else that's here is like you too.
That is a huge component for not only like the psychological or the chronically ill, but I know even without HIPAA violations, just sharing with other athletes, hey, I worked with somebody who had a very similar injury. I know how stressful this is, but this is how they dealt with it, or this is what they told me. And like you said, that just being normalized, hearing somebody else, even if it's one other person in this huge universe that we live in, has gone through it, feels a little better. You didn't screw up. It's not your fault. And to give them, I think, a lot of credit for making the steps to get better.
And particularly in the world of athletes, acknowledging that, yeah, it's miserable to be hurt and not to be able to exercise. As athletes ourselves that are pretty addicted to our exercise,
Yes.
it's not something you ever want to stop.
No.
And you know what it feels like.
Yes. I was working with one athlete that was really shamed for feeling depressed that they were out of the lineup for playing. Said, I know there's war going on and my mother's in a wheelchair with MS and I shouldn't feel sorry for myself. I'm like, you can absolutely grieve the loss of playing time. This is your PTSD. This is your trauma. This is your stress and it's real for you. So yes, comparatively, you're in a safe house and you have lots of food to eat and you're not worried about the electricity being shut off. However, your stress is your stress. Your emotions are your emotions.
If you don't acknowledge them, then they come back to haunt you later anyway.
You can only push things down for so long. It will pop up, like you said, and haunt you later on. So when we're talking about somebody who maybe really unleashes and lets you in on some trauma, if we're going to go to the FSM world, are there frequencies that you use in the clinic? Is this something that you typically say take a custom care and go home with it? Or like, how do you navigate the microcurrent side of that?
Typically it's more, here's a custom care, take it home with you. Usually I'll run the concussion program first if I'm a little hesitant about how their adrenal system is, because usually it's the adrenals that's too down that makes you not be able to tolerate microcurrent very well.
Yeah, interesting.
If the cortisol is too low, then even that little bit of energy becomes too much. But usually I'll still like to treat them the first time in office just to see how they do and give them 2 days afterwards to see how they feel for the next 2 days. And then say, okay, if you're doing fine here, now you can have one, or now you can use it again if everything's going okay. But I love the concussion relax. Putting those two guys together is wonderful. I use a lot of the emotion ones, anxiety, fear, the tendency to have chronic pain for some.
Yes.
That's still a really good one.
Yeah.
There's a couple of different PTSD ones. I have an anxiety emotion PTSD that seems to work well. But I usually tell people with all of these, it's best to be done on a regular basis. It's not, hey, you're one and done. It's, you got to be doing it for a while to really see some good results out of it.
Yeah. I think I also do similar what you were doing when you're dealing with a lot of the trauma, a lot of the emotions. You don't want to give them a custom care loaded with 10 protocols that could really make them feel like crap after. So test it in the clinic, check in with them the next day. How's it going? How did you feel? And I feel like once it's okay, you're not going to have a really bad adverse reaction like later on. So if they tolerated the anxiety one or the depression one, I've had a lot of people too, even like the really long PTSD protocol that we have, that feel very exhausted and they can feel sick after that one runs. I wonder if that is just bringing up a lot of really old energy or old emotion and bringing it to the surface. And it can be a lot to digest, if you will, afterwards.
Yeah.
So when you're talking, let's go back to the adrenals for a little bit. I remember Roger Billica, I bring this one up a lot because he was on one of his neurotransmitter, very complex talks a few years ago now.
Yeah, a bunch of years.
I must have looked like at some point I was just like, what? I can't. And sometimes you just need to put in the good before you take out the bad. I'm like, that is brilliant. So to your point, like people whose adrenals are low, like you can't just keep pulling and robbing them of things. Sometimes they need to be supported before you can take things away. So sometimes that we talk about that with scar tissue. Sometimes I will increase the secretions and increase the vitality before running the 13s to pull out scar tissue. And same thing with the emotion. So the conversation kind of bled into, do you turn down the sympathetics or do you turn up the parasympathetics? And the answer is probably yes. It depends on what have you found with situations like that?
I typically tend to pull down the sympathetics first.
Okay.
To have any sign of healing, but then running adrenal support is super helpful on there. Because then they have the ability to tolerate therapy some.
We had one of the cores, it was one of my very first cores in Dallas. We were doing the circling where everybody holds hands and Carol's running frequencies. And I was that kind of middle of the bell curve looking around. I don't feel anything. Does anybody else? And she changed it. And then one lady all of a sudden started swaying and she had fainted. And I was like, this is real. This just happened. Like, what? And Carolina very calmly scoops her up and runs something out, and she like perks up again. I'm like, can we talk about what the
Just happened?
Yeah, what just happened here? And this
Yeah.
woman just had so much stress. Like she started talking about her last week, and somebody had passed, somebody's in the hospital, somebody lost their job. Like it was just one catastrophic event after another. And this woman was literally just running on fumes. And what Carol had run was turning down the sympathetics. So we literally just pulled the energetic rug out from underneath her, and she just
There's nothing left.
There's nothing left. I think about her a lot when I have those people that I feel are redlining, thinking, I wonder in this scenario if it's better to turn on the vagus, bolster the parasympathetics,
Yeah.
at least at the same time as with two machines, maybe turning down the sympathetics. Yeah, I think, and that was like, talk about baptism by fire on my first core. It was it's real.
And I think that a lot of that running on fumes is adrenal, because it's the adrenals that get taxed when you're chronically running away from the tiger, whether that's emotional stresses or physical stresses that are happening. So if you dig enough into history, you can get there and know that adrenals are probably pretty crappy at the moment. And running the adrenals may save you from that, because you're doing exactly what the sympathetic nervous system is trying to do.
Run away fast, don't even sit down. And I think we can tell when these people walk into the clinic, they have this charge about them. It's like sometimes they don't even want to sit down. I had one person that was literally pacing like a caged tiger, and I couldn't even, I'm like, can we sit so we can discuss this? And she, oh, sorry, I didn't even realize I wasn't sitting down. I'm like, yeah, I think I know where I want to start.
Yeah, and that was exactly this guy. Even though he couldn't even walk down the hall, internally he was like this.
Yes.
And you could just see it in all of his actions, and it's making his wife crazy, he's making himself crazy. I'm like, all right.
So you'll go right to 4562, right to turning down the sympathetics. How much like vagal tone or vagal support or vagus nerve is affecting all of that as well?
I think it's a huge part, particularly with chronic PTSD. We got our vagus all turned into sympathetic versus parasympathetic.
Yeah.
So they've been there and stuck there probably for a very long time. Running it once is probably not going to turn it all off.
Right.
If this guy like had been stuck there for 60 years, literally, you're going to make a damp in it, but not a huge, you're not going to shut him down for 60 years worth of crap.
We talk about the vagus so much, but I think, like I said, the adrenal support is such an important component that we can't shy away from. And not all of us can do the testing. We just go back to adrenals.
It's easy if you're pretty convinced somebody's really low, you can do your adrenals, and then you can add the, not the vitality, but you can actually increase secretions of the adrenals.
Yeah.
And it works. I used it for migraine headaches in the past, and because I know they were always adrenal for me. So when I've had a bad headache, I couldn't take any more supplements because I was too nauseated, I'd go ahead and increase adrenal secretions, and 20 minutes later, I'm feeling better. I'm like, huh, it actually works. How about that?
I love it when we're our own guinea pigs and our own skeptics too. And you're just like, I'm like, I teach this. I should not be surprised by this. But yes, it just took my pain away. And now I can move, and now I don't have a headache. And we go. So vagal support, emotional support. What are some of we talked a lot about, the last time we were on, we talked a lot about sleep. I think one of the main things that I worry about is, are people sleeping at night? I can give the best treatment and advise the best exercises and get them on the best nutritional plan. But if they're not sleeping at night, how much of any of that is useful? Probably not.
Yeah, because if you're not sleeping at night, you're in fight or flight. And when you're in fight or flight, you don't heal by definition. That's where Steve Porges and all of his stuff on the vagus comes in so important, because you literally aren't capable of doing it. And that's where treating PTSD, treating all the external that caused the parasympathetics to go off with the vagus is really nice over a regular basis, and then you're gradually dropping it. I love the PEMF converter, because you just throw that in everybody's bed. They run it every night, and they're awesome. Again, it's always a money thing, but if you can get people to the point that they're able to do that, and then they start seeing the benefits of running it every night without interrupting their lifestyle, because that's the other thing. Nobody wants to interrupt their life, even to run a program. But if you got that and then they're running it every night, it's life-changing within weeks.
Right. And that's what also is, I'm really good at writing programs, but the programs are only good if they're being utilized. They're not helpful when they're just sitting on a custom care and the custom care is in someone's desk. So yeah, the magnetic converter is a fantastic way of getting application at night, because you don't have to deal with stickies. You don't have to deal with wet towels in your bed. And for frequencies like vagus, the emotional components, PTSD, sympathetics,
Concussion.
Just
Running that over and over again.
exactly. Put that on loop at night if you need. So many things that we can do while we're just sleeping. And like you said, not interrupting our busy lifestyle. We were talking a little bit about, so if we're going to shift the gears here from microcurrent, we're talking about things like drugs, alcohol, tobacco. How much do you think statistically those things impact healing? Somebody who is a smoker, for instance. And do you have that conversation? Like, I can only get you so much better, but if you continue to smoke, blah, 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 blah.
I won't accept a client in my practice that's smoking.
Look at you.
I can't.
Like, asking
They'll
them
never get better.
and putting your foot down. Wow.
Yeah. I will literally tell them, I am all excited to get you better, but I will not be able to do it if you're smoking. Call me in a month. I want you all the way off. And here's your progression. Here's what I suggest.
Wow.
They're using every antioxidant in their body up to deal with the carcinogens from tobacco. Done.
Yeah. Yeah. So that is do you have any other deal breakers like that?
I wish I could say marijuana was, but there's just too many people doing it. And for most people, it's because of anxiety, and anxiety is part of their process. And so I definitely put limits on it. I got a kid that I was just seeing, addicted to alcohol, addicted to marijuana, addicted to gambling, and parents are way too enabling. But I went ahead and said, okay, here's your limits. You're going to do gluten-free, dairy-free. We're going to do all the testing. You're limited to no gambling, no alcohol, and one joint a night, or one whatever he's using at nighttime.
Right.
He made it most of the way. He's still smoking too much on the weekend. But I said, I can't take you if you're doing this, because you're not going to get better. You take away willpower, you interrupt your brain function, you're killing your testosterone with marijuana. Like, we all know it plummets with marijuana. So I'm like, there's a lot of good things you're hurting here. And in the end, he was like, you know what? I'm in. I think I'm going to die if I don't do what I'm telling you. But literally, I said, here's your guidelines. Here's the testing. I'm not working with you until you can stick to a plan at least 90% of the way to get better. And that was today, where we followed up all the labs and followed up how he was doing. And I have to do this or I'm going to die. And I'm like, you're probably not going to die, but you're not going to be feeling real well anytime in the near future unless you do something. So he was able to commit.
And maybe that sense of urgency is what he needed. If he felt he was going to, I think that sense of urgency can, yes, and it's part of anxiety, but that component, I have to do this or else, does get the job done sometimes. Mm-hmm. So for my athletes, it's almost the opposite. They can't wait to get back to everything. So I'm pulling back on the reins more than I'm like trying to get them to do anything. So I think sometimes it's knowing when to put those parameters in place.
Correct.
I think for the practitioners that are listening, I think it's a really good point. We can't be the enabling parents that are like, oh, you can do whatever you want and I'll still be here 3 times a week. And yes, it's great financially, but ethically, I want to do a great job. And I think we have to have those conversations with people.
Yeah. And actually the kicker for this kid, because I was like, listen, this is a big deal. You got to be on it to get better. You're really sick from mold toxicity and we can fix this, but you got to be on your game to get better. And your parents are paying for it. Terrified him more than anything when I told the parents the price and he was in the room, he lost it. He literally got up and walked out.
Wow.
And because he's, oh my God, I said, yes, this is the point. The
Yeah.
point is that you're committing means your parents are paying a lot of money for this, which means you dang well better do what you're supposed to do, or they're throwing money away.
And so this also leads me to think, so you have that sense of urgency, you have the price tag, you've got like people who are quote unquote on the hook to get better. Do you still encounter people that maybe lie or just say, oh, I am doing everything and it's still, and blaming you maybe, or they blame us, like your treatment doesn't work?
Yes. And that's when I do the coaching on self-sabotage. I was like,
Yeah.
if you've decided to go forward with me and you've decided that you really want to get better and you're going to do everything I ask you to do, because that's the only way we're going to get better. If I find you self-sabotaging, I will be calling you on it and I'll be sending you to somebody, because I can't do all of that. My job is to keep the pathways narrow and to keep you on that pathway. But if you're self-sabotaging, I got good people in there. I got a hypnotherapist who's amazing. I've got a psychologist that's phenomenal. We got people, and you can have other people out there if you want, but then you're the problem, not me.
Yeah. And I think sometimes, and let's face it, some people are very chronically sick and they've been stuck in the system that's passed them on and passed their symptoms on. But there are some people that are just looking for an excuse of why things aren't working. And sometimes it can be it can be a lot of work to make a lot of lifestyle changes.
Oh, it is.
Going back to, we talked about cutting out gluten and dairy. Do you cut those things out right away, or do you rely on food sensitivity testing, or is it a combination of both? Does it depend?
It depends on the person, but most of the people, by the time they come in to see me, they're one or the other of them is sensitive. They're sensitive to one or the other of the two. So eventually we do cut it out. Usually it's not the first things we do because that's too hard. Usually we cut out sugar first, fruit juices, soda, that stuff. That's your first week. Let's get sugar that's inflammatory for everybody out of the picture. And then we start working on heavily processed crap. And then the next step along the way is, okay, there's the gluten and dairy, and let's take that out. And usually by then they've made enough easy changes that they can handle the harder changes. So it is always a stepping stone.
You can't just cut everything out cold turkey.
No. And they throw it all out the window.
And then I guess too, you want to just incrementally see what's making them feel better. So
that's the other half of it, is it's take out the really obvious things first, and then they start feeling the difference, and then they trust you more to be able to take out the rest of the stuff that's even harder.
how much and when does alcohol come into there? Or does that depend also?
Usually that's the second week.
Okay. Yeah. So sugar is like,
sugar's the first week, then alcohol's the second week. Alcohol and start working on caffeine, because it's always a start working on caffeine, not finish working on caffeine.
I am not drinking caffeinated coffee. Since working with you, I used to always have to have my 2 o'clock coffee, and I haven't had it in years. I have my 1 cup in the morning that I don't even need right away. I remember I needed like coffee to get to the coffee.
To get to the exercise.
Yeah, exactly. And it is amazing. And you don't really, I don't think, realize how addicted to things that you are, because it's part of your lifestyle. It's part of the day to day. And I think sugar is actually a really big part of that. We don't realize how addicted we are to have something sweet sometimes.
And I think, what I find in a lot of my sicker clients that have a lot of stressors or a lot of adrenal insufficiency, they all crave sugar to bump up their energy. So then it's a matter of teaching them, you're not a bad person for choosing the sugar. Your body is demanding sugar to give you energy because it doesn't know how else to get energy. So that's your lesson to when you're finding yourself craving sugar, your adrenals are too low. Guess what? We got this really nice supplement that'll do exactly that for you. And then you don't need the sugar later. Watch a couple of days, see when the sugar cravings hit. Those are your low periods. Add your adrenals an hour beforehand. And guess what? You won't need that sugar.
It is amazing how we self-medicate when it comes to sugar. And I don't think that's an obvious thing. Like, we'll hear people who self-medicate with wine at the end of the day. I have to have my glass of wine so that I can sleep. And I'm just like, that's not a good sleep.
That's going to make it worse, actually.
Make it worse. Yeah. And you don't want to be judgy, but it's like, I can't go to sleep unless I have a glass of wine, or I can't go on my day unless I have my 2 o'clock cup of coffee. And it's just, you do realize that caffeine and alcohol these are drugs to your body, and you are addicted to this stuff. and saying it in your non-judgy voice, of course.
And I think that's one of the reasons I talk a lot about sugar, because everybody feels when they're coming to see me, they actually feel guilty for eating all the sugar. And a lot of them are complaining about their weight and still think, oh my God, I find myself eating sugar all the time. It's, hey, take away the whole knowledge of willpower.
Yeah.
Willpower comes from adrenal function. It doesn't come from up here. It comes from energy. You have to have energy to have willpower. If you have no cortisol, you can't have willpower. And that's why you eat all the stuff to increase your energy, but then you've already killed your willpower in your head. You're feeling like a bad person because you ate what you weren't supposed to, but it's because you didn't have energy.
That's amazing. You need to say that one more time for the people in the back, because that is I always learn so much from you, but that is huge, because we do see that with people when it comes to therapy, exercise prescription, whatever they're trying to do, they feel like they have no willpower. And you think, oh, I'm just not mentally strong enough.
Nothing to do with it. Your willpower 100% comes from cortisol. You need to have energy to have willpower. It is not a mental thing. It is energetic. And if there's no energy, there's no willpower.
That just makes so much sense why people are caught in that like sloth loop of I don't have any energy to work out. I don't have willpower to cut out sugar. And then they're caught in that cycle of sugar crash, and they think it's because they don't want it bad enough.
Right. And having been just myself personally going through a divorce over the last 2 years, like I find myself when I have to stay up late at night to do some work, I'm eating. Sure. And it's always, okay, forgive self. My adrenals are the lowest that they've been in 15 years right now.
Yeah.
And yes, I can take more supplements,
yeah,
but just know that where it's coming from and take out the self-blame, because self-blame only drives you down further. So that's what I'm doing to them, is bringing them back up and saying, hey, this isn't you. You're not the problem. It's your energy that's a problem. Take out the self-blame and the I'm a bad person, I'm weak, I'm whatever the story is.
Wow. I hope everybody who's listening right now live has their brains exploded on the back of their chair like I have, because I've never really put that together. And it just it's one of those things, like once you see it, you can't unsee it. So once we hear this, I think, if anything, I know we've only been at this for half an hour, but the goal of these podcasts are to give, I think, everybody a little bit of information, the practitioners that are listening, the lay people that are listening. And I think people who are chronically ill have had so much self-blame already that that's the last thing they need to do, is when they try something new and they don't have that quote unquote willpower to follow through. How on earth can we just take all this stuff away from them and say, just follow these instructions and expect them to do that? So giving them that knowledge of, you're not a weak person, this is an energetic issue, I think is going to help so many people. Because, and we see this, what happens all the time in fitness, and we see this in like the new year, everybody has these New Year's resolutions, and we have all this energy, we have all this excitement around who we want to become. And then pedal hits the metal and you're just like, I can't do it. And
2 weeks later, it's all gone.
It's all gone. That's right. But like people didn't have the support to continue on. So I think this was a huge little nugget that you gave all of us. And the self-blame is, I think we see that a lot too with everybody. Yes.
For sure. Hey, most of my chronically ill patients come in here and think it's all their problem, that they caused all those to them. And I remember when I had all my years of daily migraines, I was like, man, I ate all the wrong stuff. I did this and that and the other thing. I didn't pay attention to my sleep. I had 1,000 things that I did that were the reason why I was sick. And in the end, it had nothing to do with any of that. It had mold toxicity and everything was going down regardless of what was happening. And did I have some responsibility? Maybe, but I was doing the best I could. As an athlete, I was eating and drinking and sleeping and doing what I thought was the best with the best knowledge that I had. And so taking away the responsibility for illness is also really important for people.
Yes, we have a couple questions. I always have my alarm that goes off halfway through to check the chat. I don't know if you have access to it, but I'm going to show, or I'll read some of the ones out here. Mind blown. Yes, people do not need more self-blame. That's right. Somebody asked here, do you recommend any particular adrenal support supplement?
My favorite right now is one called Perfect Adrenals by It's by Pure. I don't have a
I have
bottle.
I have it in my pantry. I can go look.
Yes, you can do that.
It's amazing.
It works very well.
Yes.
It's not yet on full scripts though, because it was made by a different company before, Iogen, and then it got sold to Pure, and Pure hasn't been able to get it on full scripts yet, which is annoying.
Yes, but it is, I'm gonna look it up really quick because it's on my phone, because I took a picture of it here.
Pure Formulas, maybe?
Maybe. It's not pure encapsulations.
No, that's not that pure.
Someone just wrote that.
I could get a bottle. It's in my hallway.
Oh, here it is right now. Is it integrative therapeutics? No, just kidding. I will grab it from the pantry.
Give me half a second. I literally
Okay. Dr. Jen is going to get it because she put me on it, and I can say it is amazing because I was that person that crashed at 2 and always needed sugar after I ate lunch and sugar after I had dinner. And I didn't realize what that sugar craving was, but my adrenals were all over the place. So I was just saying how I'm a true testament to this supplement because I was the sugar person and the caffeine person.
So it's Pure Prescriptions.
Pure prescriptions.
That's what the bottle looks like.
Yes, and it's called Perfect Adrenal. It works like
a charm.
It works like a charm. Yes.
Yep.
Feel amazing on it. Okay, so there's a long question here. I'm going to go to some of the shorter ones here first. What program do you recommend running at night for sleep?
I typically start with Concussion Relax.
Yeah.
As my first choice.
Yeah.
And then I'll run the sleep one, the short sleep one if we need to.
Okay, so concussion or concussion in Vegas first and then sleep, or relax and balance.
Relax and balance, concussion in Vegas. Yeah, both of those are good. I will find if somebody's waking up a lot, that oftentimes is low blood sugar in the middle of the night. And that can be sleep apnea or that can be poor digestion. So a high protein snack right before you go to bed, like a scoop of nut butter, is one of my answers. You've heard that one too?
You did, you told me that. So I'm in California, so I have access to very good walnuts. So I usually have a little handful of walnuts, and sometimes it's amazing. Just that little scoop of nut butter or the little bit of walnuts is so helpful.
Mm-hmm. Yep. You missed the 3 o'clock wake up with that one.
Yes, I sleep like a baby. 8:30, 9 o'clock, I'm in bed, and I don't wake up until 5 o'clock the next morning.
Bed that early.
That's why I don't text you back sometimes. 8 o'clock, the phone is off. Yeah. So yeah, that's my thing. So I'm going to read through a little bit of a patient history. There's a little bit of a case report. So we have a patient here who's got 4 peroneal decompressions, proximal fibular head. I don't know if you can read this at the same time, but it's in the Q&A. But I'll say it out loud for the people who are listening to the podcast. Compartment syndrome, fasciotomy, directly inferior to incision sites, entrapment, painful biceps femoris tendon, FSM, not post-op, not acute care performed, no pain during treatment. Client reports initiating low-dose Lyrica 3 days prior to first FSM session without prior discussion. Best way to proceed with Lyrica on board when there is no pain to inform effectiveness of FSM. So if somebody is on Lyrica, any kind of drug is difficult to treat with FSM when we don't know if pain is being present. What do you say about that?
More in the musculoskeletal stuff is your side, but I will say if they're still having pain, then you have a place to work with. If they're covering up all the pain, good for them. On the other hand, then it's harder to figure out what you're treating. And the same thing with autoimmune disease. I'll tell people prefer that you're not on drugs for autoimmune disease if I'm treating autoimmune disease, because I don't know how it's working. If you're on drugs, I don't know what the drug is doing versus what I'm doing.
Right.
On the other hand, if they're horrible, I'll tell them, nope, you can't get off. We'll be able to try to get you off once you're not having any symptoms beyond the autoimmune drug. And then we can say, okay, now's a good time to try to take off the autoimmune drug.
Right. And pain is one part of showing efficacy of a treatment. Like obviously we want somebody's pain to go down, but if they are on drugs, yeah, it's hard. So I think about what we do with post-surgical people. So right after surgery, sometimes there's a lot of drugs that they are on that we're not telling them not to take. This is pain management. So we're looking at things like inflammation. That is something that we can see sometimes inflammation go down. I measure inflammation all the time. I'm working with an athlete that had a tear in his quadriceps. He doesn't have a lot of pain, but he has a grade 2+ tear in his quad. But I can measure the girth of his quad and I can see it slowly deflating over the course of an hour. So we've got things like range of motion, we've got pinwheel, we've got measuring girth for inflammation. So when you've got something with a drug that is decreasing the sensation, use some of those other modalities to see if it's effective. And let's face it, sometimes post-surgically, the name of the game isn't necessarily pain. It's just about promoting the healing, stopping the bleeding, all the things that are going to set them up for success later on. The second part of the question, any way to ensure that when weaned from Lyrica, underlying issue is addressed? And then when should she consult Lyrica prescribing doctor to wean from Lyrica? Example, no pain from activities for how many days or weeks? The prescription part, I'll let you start with, and then I'll jump in.
Yeah, and Lyrica, if somebody's only been on it for a couple of days, I think somebody said they'd started it 3 days beforehand. That kind of stuff you can stop without any concern if you've only been on it a very short time. If they've been on it weeks to months, then you need to wean off of it, because otherwise you'll not be a happy camper and you have risk of withdrawal symptoms from Lyrica for sure. But otherwise, it's having the client just go back and asking the physician, hey, my therapist doesn't want me to really be on this at the moment. Can we drop it, or how would you like me to drop it, so that I can figure out what's real here and how much is working for me?
For sure. I think the other thing too, when we start talking about getting people off drugs, of course, it's not in my scope. It's not in a lot of our scopes to say, stop taking this prescription. Going back to what we had talked about, sleep is so important. So if pain is so bad, it's waking them up at night and they cannot get sleep. Even if it's a pain, we don't want all of our people on painkillers necessarily, but if it's helping them in those stages of healing to get a good restful sleep, I'm okay with that. So I'm in no big rush. If it's that type of pain that's consistently waking them up and this medication is allowing for sleep. But like you said, there's that time and place where we're like, okay, you can't be on this forever. And having the discussions, what holistically could replace this, having a physician like yourself that sees both sides of it. And it's not just a prescription, but let's take Lyrica and turn it into a different supplement maybe, or
Right.
maybe taking the caffeine away at night so that you can fall asleep naturally instead of artificially.
Right. Or just using some ice at night. Sometimes just putting some ice on for half an hour does a world of difference. And that's so basic, most people don't even think about it anymore.
You're right. I have this big conversation. I think everybody knows that I'm anti-ice. There is the book I talked about last week was Ice, the Illusionary Treatment. Dr. Gabe Merkin, the doctor that coined the term RICE, rest, ice, compression, elevation, wrote the foreword to this book saying that ice didn't help with inflammation. But the but here, people, is I'm not saying never use ice, but ice isn't necessarily going to help with healing, but ice is analgesic. So to your point, getting those frozen peas out at night and putting something cool on an area that feels inflamed, that feels hot, that feels uncomfortable, numbing it that way a little bit better externally than numbing it internally with wine, vodka, Lyrica, whatever people are doing to medicate that. So it's a great point that I think we all have access to ice typically, or something cool. Some of the other person you're talking about left and right, Allie had written in iridology, the left side of the body represents mother, the feminine, spiritual issues, non-maternal things. Right side, father, masculine issues, maternal things. That's very interesting.
Yes, it's interesting, and because this guy was all one-sided and his mother was the issue for him, and mine was always all the other side, and my dad was my issue. So I was like, who knew?
That is so funny. I'm going to read that one more time again. In iridology, the left side represents mother, the feminine, spiritual issues, non-material. Right side, father, masculine issues, material things. So
And I was always told differently. I was told just the opposite, which is interesting. So you would think it would all be the same from everybody. Everybody always told me the left side was more the male, but
food for thought, something that we can all Google later and for ourselves. I typically have what I always say, left side itis. If something is going to happen, it's always going to be on my left side. So mommy issues, daddy issues, I probably have both, and I can go
Who
either.
doesn't?
No, but again, like that's what we talked about, is like helping to put all those pieces together.
And that connects the psychosocial into the current, because if you're all one-sided on something, there's something there.
Yes.
Part of it, she just injured one piece of it and it just wanders all its way up and down. We know that too.
Sure. Yes. Yeah. But I think we talk about the more tools in our tool belt, the better. And so the different ways of connecting dots, I think it's information. And there's a lot of things in a history that we take, some we leave. But some of the times I go back and I'm like, how come I never put that together? And I heard the history, but maybe I just wasn't ready to add that component into the treatment plan.
Yeah, the more ways you can approach all these things, you'll eventually hit the one that means something to your patient. And that's ultimately where we're trying to get, is what is it that's really going to get them moving forward in the right direction.
And I think sometimes like we give up that information when we're ready to, and maybe it comes at the most divine part of the treatment. There's been so many times where I've had people who have plateaued. And then I'm like, okay, you know what? We haven't had a ton of success in the last little while. Let's go back. And what else can you tell me about this injury? And then like, it was fine until I had that second car accident. And then I got divorced. And I'm like, oh, I didn't know about the second accident or the divorce or the custody or the this and the dog ran away and the move and the, okay, let's try something else. And then I'm like back to the frequency drawing board.
Right.
So
I got one for that.
there is a frequency for that. And again, I wanted to talk also a little about, we're talking about head injuries, and we get a ton of questions about mast cell and perimenopause. And I want to just go into this perimenopause world for just a second, because again, I think a lot of these patients that we're seeing are told it's all in your head, or you're just tired, you're a busy mom, you're this and you're that. And if you're, again, running on fumes, no energy stores left, I think we're seeing more doctors doing like salivary cortisol and doing those hormone checks. Is there anything that you, as just a baseline, if you see somebody in that woman in that perimenopause age, that you go to testing right away and say, let's just see where you're at?
Just to take a step back from that, most of us are too stressed out nowadays. There's too much stuff going on. So very few people have very good cortisol levels nowadays.
Okay.
And when your cortisol goes down, your sex hormones drop, because your body is smart. And it's like, hey, there's a tiger chasing me. I'm trying to keep those adrenals up and I'm having a hard time doing it. I'm not going to waste energy creating sex hormones if I'm being chased by a tiger, because now's not a good time to have kids. Ultimately, that's where the body's at. And so it's a good way to picture it for people too, to say, hey, listen, the more you let yourself continue running crazy and not taking downtime, the more you're hitting your sex hormones, which means you make menopause doubly as bad, because you were supposed to still make some after you hit menopause. And right now you're not making any because you hit menopause, because you got this other stuff going on at the same time. And so that's one of the big things going on with all of us women nowadays, because everybody's too stressed out. There's no downtime. There's always something going on for all of us. But then you've got all the toxins in our world today, the pesticides, the plastics, all this that act like estrogens. So I think I have literally had one woman in 15 years of doing what I'm doing that actually had normal hormone levels.
Wow.
Sit with that for a second. One out of 15 years of doing what I'm doing that's had normal hormone levels. I was shocked. I was like, I've never seen it.
Unicorn.
Yeah. I'm like, what are you doing differently? Obviously, there's some really good genetics there, but oh my God, one. That means we're all screwed. And there's a point to a point. That's why women didn't used to have problems with menopause, but we all have problems with menopause because everybody's increasing their estrogens too high, not making nearly enough progesterone, and then we're dancing out of our skins at night because the balance is all off. So I think almost all women, by the time they're getting in that perimenopausal time before they lose their periods altogether, almost everybody would benefit from some progesterone. You almost don't even have to test anymore.
Wow.
But if they've had endometriosis or fibroids or fibrocystic breast disease, then they got way too much estrogen and they're going to need some, just some of those basic diagnoses in there.
That is so interesting that most of us are just suffering from that, because you're right. Like, nobody really talked about menopause or perimenopause years ago. And I just figured I was young, so I didn't care about it. So it's like, now that I drive a white 4Runner, I see them everywhere. So I'm like, now that I'm going through this, I'm hearing about it. But it's an interesting thing that you're saying, no, like, we're all suffering from this. And yeah, it makes total sense when you give the analogy, we're running away from the tiger. So why on earth would we want to make babies?
Yeah, we just shut it down completely. But our body's making too much estrogen in spite of it because of all the plastics and pesticides. And so the progesterone suffers, but the estrogen doesn't as much.
Wow. We have a few minutes left. I don't know if there's anything else that you yourself want to touch on or talk about before we end, but I feel like I have a million more questions, but I wanted to give you a platform if there's anything you wanted to mention.
I think you had talked for a second about head injuries and mast cell stuff. I would say with head injuries, one of the biggest things that I've seen that creates a really unhappy, unrecovering person after head injuries is adrenals. That dang pituitary is in the middle of the head, never gets looked at. And so if somebody's really not recovering and really exhausted and not thinking clearly, they probably got some major adrenal issues going on. And some of it may be pituitary in origin rather than just the stress of the whole ordeal.
Yeah, that's really interesting. So I think about athletes, I think of motor vehicle accidents, I think of like our first responder, anybody who can get a head injury. We typically just throw those symptoms under the stress of the injury and not the adrenals itself.
I've had a number of clients that are literally in adrenal failure and have been walking around in adrenal failure for years and had no idea and were wondering why they felt so crappy all the time. But nobody, even in the ER, even with really bad head injuries when you're in the ICU, nobody thinks to check any of that.
Wow. And it makes so much sense now that you're saying it.
Yeah, I found I had a really big head injury in 2000 that led to all my 6 years of daily migraines that Carol saved me from with my microcurrent.
Yes.
So I'll always thank her for saving my life. But what I realized later on was my headache started 4 years after my head injury. So I didn't even connect them because it was just a fall off my mountain bike and it was not a big deal. But years later, after I'd gotten better, that was great. Microcurrent's marvelous to get the adrenals back. But about 7 years later, I had a big stress and a couple of big stresses at the same time in my family. I dropped my adrenals really bad and I ended up 7 days of migraines all over again in panic going, oh my God, I'm not doing this again. Still didn't really understand at that point in time it was all adrenals because microcurrent had cured it and never really knew what it was. Carol's understanding was different than mine for what was going on. It was probably some of both. But when I was really bad and ended up in the hospital, by the 7th day, I was like, oh my God, what do I always ask for when my migraines are really bad? I ask for Decadron. Decadron's the only thing that gets me out. What is that but a steroid? And now I'm full on into functional medicine, so I understand adrenal stuff. And I'm like, I always ask for a steroid. I'm like, oh my God, my adrenals must be really bad. Give me a steroid and I'll get the hell out of your ER, which I did. But what was funny is that I asked them to test me the next morning for cortisol. And sure enough, my cortisol is nothing. So I ended up doing adrenal testing with an endocrinologist a couple of months later. My adrenals suck. I can't run a normal cortisol progression. It's supposed to be your cortisol is supposed to be up within an hour of a stress. And mine didn't come up until 6 hours later.
Wow.
And it just barely at the level that you could say it was sufficient, not a good level, just barely sufficient. I'm like, oh my God, no wonder I've been fighting this for years and years. Who knew?
Yeah. But that's just it. Who knew? And so now we have all this information. So we're already at 4:00 and I knew this was going to happen, but thank you so much. Between the adrenal nuggets and it's not your willpower, you don't have enough energy. Oh, so one quick question that came in, is there a good adrenal test that you recommend?
If you're testing to see how their adrenals work, I would throw that at an endocrinologist and you just got to picky about who you choose because literally they give you a drug and then you sit there for 6 hours and they check you every hour, every half hour at the beginning and then every hour, and you're not doing that in your office.
Yeah. So
Otherwise, it's salivary hormone testing, but that doesn't tell you anything about how well it picks up with stress. And that's what the adrenal stress test is all about.
Dr. Sosnowski, thank you so much for coming. If anybody wants to see more about Jen or hear more about Jen, Jen's clinic is called MVP Medical Center. She's in Scottsdale. You can look her up. She's amazing. Go see her. She's helped me so much. So again, just so grateful that you spent some time with us today and unpacked some very amazing pieces of information for us. So thank you again.
Thank you very much, and sure happy to help anytime.
Yay. We'll have you on again. Thanks, everybody. And we'll see everybody again. So thanks.
Bye, guys.
The Frequency Specific Microcurrent podcast has been produced by Frequency Specific Seminars for entertainment, educational, and information purposes only. The information and opinion provided in the podcast are not medical advice, do not create any type of doctor-patient relationship, and unless expressly stated, do not reflect the opinions of its affiliates, subsidiaries, or sponsors, or the hosts or any of the podcast guests or affiliated professional organizations. No person should act or refrain from acting on the basis of the content provided in any podcast without first seeking appropriate medical advice and counseling. No information provided in any podcast should be used as a substitute for personalized medical advice and counseling. FSS expressly disclaims any and all liability relating to any actions taken or not taken based on or any contents of this podcast.